think when you think about the tensions and the difficulties in healthcare, we're almost stuck in a bit of an old model, and we're delivering care the way that we've delivered it for a long period of time.
Pagers have played a very important role over the decades, but the technology now is extremely dated and poses significant problems in the clinical environment.
What you see is nurses trying to get in touch with doctors, and about 15% of the time they get the wrong person. And then those physicians who are even getting paged, they're getting a number. They're not getting context of whether something's extremely urgent or not urgent.
They're responsible for a patient's life. And so relying on these simple tools to coordinate such complex processes, it was asking too much.
A few years ago, it was only physicians in fairly senior administrative positions that had access to smartphone technology. We now have approximately 1,000 BlackBerry smartphones in our enterprise, and a significant percentage of those are utilized by clinicians.
What we've done is we centralized communication for the nurses. So we created a simple web paging form. It's available on every computer on our network through the intranet. It allows the nurse to send an email message to the BlackBerry smartphone. Now with the nurses able to communicate with the residents in a simple fashion, we're able to provide context for the residents in a less disruptive process for communication.
I'd say one of the major benefits to workflow is being able to differentiate fairly routine calls and communication from those that are urgent.
What that allows them to do, it provides them time savings, and so they have more time to increase the circle of care. So now they're able to communicate with other clinicians, the interprofessional team that previously they may not have had the time to do so.
There was a time when healthcare was really about one illness, so you'd come in and you'd have an appendix problem and they would take it out. Now what we're finding is there's a lot of chronic disease, so people come into hospital and they don't just have a heart attack, they have a heart issue, they have a heart issue with cancer and kidney problems. So a lot of healthcare with chronic disease is coordinating care amongst multiple different professionals. Now what we are able to do with the smartphone technology and the solutions we've created is create email threads amongst all the different providers, and that allows us to get to a decision point of multi-different system issues within almost 12 hours rather than a week.
So it's not unusual that we end up caring for patients either through our smartphones or our secure mail system to come up with decisions with other clinical care providers that we never actually meet face-to-face.
A lot of patients are often told different things by different providers, and when you get down to what their experience, where they have difficulty with their experience, they often find that the team isn't coordinated in their communication. And this is where we've seen a dramatic change, and where we're able, because of the BlackBerry smartphone, able to coordinate communication among our team of physicians, our social workers, our nurses, so we're all on the same page.
We can see that there's been a lot of investment in information technology, and a lot of that, rightfully so, it has been around the electronic health record. But sometimes we forget about the importance of day-to-day communication, and that's why the BlackBerry smartphone is in a unique position, because it is the communication device of choice. From an IT management perspective, the BlackBerry Enterprise Server allows us to remote manage devices, so we no longer have to go and touch every individual device. Centrally, we can push policies, we can push applications, which saves us a lot of time, but then provides much quicker service delivery to our clinicians.
So any technology solution that does not provide a very robust privacy and security framework is not acceptable in healthcare. Now fortunately, with the BlackBerry smartphone, there are a couple of advantages that include the ability to wipe the device clean if it's ever lost, the password protection ability, and the fact that there's very little patient data that resides on the device itself.
When I think of what I imagine what would be an ideal model, it really is about a patient-centered care where patients can interface with the providers that they need at just the right time. And all the waste, all the paperwork, all the disrupted phone calls and all the waste that we do in our day goes away. and we actually get to spend our time taking care of patients in a collaborative model. And technology like the BlackBerry smartphone and the work that we're doing is incrementally getting us to that point. And I think 5 years from now, the way that we practice and the way that we provide care will be very different. And I think it'll be far better, both in quality of care for patients and also the experience of care for patients.